Sexual disorders. Are you suffering intimately with your partner? I have one big question. What is the most important sex organ in your body? Well, the answer is your brain. Of course it is. The brain is the most important sex organ in the body. What have you thought? Sexual function is a product of mind and body. Even the brain is considered the most significant sexual organ. Sexual health plays an essential role in a person's overall physical and mental health. Sexual disorders can prevent an individual or a couple from enjoying sexual activity. Do you know 43% of women and 31% of men report some degree of sexual dysfunction? Sexual problems cause enough distress among couples that it raises to the level of sexual dysfunction. It can happen at any time, at any age. It is more common in those over 40 because it declines with age. Sexual health is an essential factor for a healthy life, but unfortunately, it is often ignored. Active sex life is not only a biological need, but it has other countless benefits. A healthy sexual life can boost immunity, improve the sleep cycle, and pain management. Sexual disorders generally fall into 4 categories. Let's get through them one by one. Arousal disorders. Primarily, the inability to become aroused or excited by sexual activity. A lack of mental, emotional, or physical response to sexual stimulation characterizes arousal disorders. For men, the most common sexual dysfunction concern that increases with age is erectile dysfunction, ED. According to the studies, about 52% of men who were between 40 and 70 age group experienced ED. For women may experience no genital sensation, vaginal dryness, or lack of swelling in the clitoris. All these arousal problems can make having sex frustrating. Desire disorders. The most common thing between men and women is desire disorder, or lack of sex drive. Factors from relationship issues to stress can also affect desire in men and women. Besides, hormonal changes can play a role in both genders. Those related to menopause, for instance, can decrease sexual desire in ladies, while in men, it is linked with low testosterone levels as the age increases. Symptoms of lack of desire include an ongoing lack of sexual or erotic thoughts, fantasies, and sexual desire. According to one study, the prevalence of low sexual drive in women ranges from 27% among premenopausal women to about 52% among natural menopause women. Mostly, lack of desire is coupled with other sex problems. Orgasmic disorders. The other category of sexual disorder is anorgasmia. It is the inability or difficulty having orgasms. It is common for both women and men. For some women, this means never having an orgasm. Others who have been reaching orgasm are no longer able to do it or find it much more difficult than they thought. About 5% or more women suffer from anorgasmia. For men, issues related to orgasm include premature ejaculation. About 1 in 3 men experience this prevalent issue. Retrograde ejaculation. When the semen enters the bladder, so the man does not ejaculate much. Delayed ejaculation is characterized by difficulty reaching orgasm. Painful sex. The last type of sexual disorder is painful sex. Women report that sex is painful much more frequently than men. It's also referred to as dyspareunia, when sexual intercourse or penetration of any kind causes pain. Some women suffer from vaginismus, less commonly. It is also a disorder in which muscles around the vagina involuntarily and painfully squeeze or spasm. This makes it impossible to have sex. Just as there are many different sexual disorders, the causes for these vary significantly. Relationship problems or poor communication between partners can be an issue. Physical causes: diabetes, heart disease, neurological disorders, hormonal imbalances, and much more. Psychological causes: stress, anxiety, marital or relationship problems, depression, concerns about self-image, and effects of past sexual trauma. All of these and more can cause sexual disorders. Substances: drug abuse and alcoholism can be the root cause. Treatment depends on the specific cause. Sometimes, 1. Treating an underlying medical or organic condition will resolve the situation. 2. Also, for the psychological causes, counseling and psychotherapy provide a great help. The longer a sexual dysfunction goes on, the more your level of stress and anxiety rises. Things can escalate if you don't discuss it, so it is better to discuss with your therapist. A therapist can teach you how to cope with your stress and anxiety. Joint counseling alone or with your partner can help improve communication and increase intimacy. Communication is important. Sometimes support and education about sexual behavior are all that you need. You can address specific stressful factors and other inhibitors in counseling sessions. For deeply rooted sexual disorders, psychotherapy may be necessary. If you want more videos, check out our channel for more updates. Don't forget to hit the bell icon. Check the description link below for recommended useful resources. And feel free to share this video.